Hello toppers, today we are going to discuss regarding the 10 must know signs in dermatology, which is one of the high yielding topic. So here we will be having localized urticaria and rubbing and bathing. You can see the urticarial lesions in the back of the children. So try to guess the condition where we can see this localized urticaria. So it is seen in urticaria pigmentosa, it is seen in histiocytosis, and it is also seen in leukemia and juvenile xanthogranuloma. Try to remember all these four conditions, and this sign is also called as Darier's sign because this urticaria pigmentosa is also called as Darier's disease, and this histiocytosis is also called as mastocytosis, so don't confuse. So here in this image you can see individual follicles clearly where we can see the hair growth also, and here we can see white stuffs here and there. So these are all the keratins which are coming out of the individual follicle. So whenever if we are putting the light in the tangential way, we can see the keratin glinting over these follicles. So this we can see in keratosis pilaris, and this sign is also called as antenna sign. And here on examination also, if we are putting the hand and rubbing over the lesion, we will be having a sand grit feeling. This will help us to diagnose the condition easily. And in this image you can see two different swellings. One is inguinal lymph node swelling, and the another one is femoral lymph node swelling. And here we can see the separation between these swellings, that is none other than the inguinal ligament. Now try to guess the condition where we can see the involvement of lymph nodes in the groin region, and it is also belonging to a specific infection. So let's see what is the answer. This sign is called as groove sign because here, because of the lymph node grooving between the inguinal and femoral lymph node, they got separated, and this we can see in lymphogranuloma venereum, one of the sexually transmitted diseases. And in this image you can see the discoloration of nail bed. So let's see where we can see this condition. So this is nothing but the oil drop sign. Like you can see in this image, once if the oil is dropped, we can get these type of discoloration. So this is also called as oil drop sign, and this is seen in psoriasis. So here, because of the hair shaft defect, patient sees hair on the pillow on getting up in the morning. So let's see the sign, name and disease condition. So this sign is nothing but pillow sign, and it is seen in Netherton's syndrome. So here you can see the swelling near the eye where it is caused because of the reduvid bug bite. So I think you can guess the condition easily because of this reduvid bug. So this reduvid bug mainly causes Chagas disease, which is caused by Trypanosoma cruzi, and this sign is also called as Romanas sign. So here when the skin is stretched across the long axis of herald patch, we can see the scales very finer, lighter and attached to the one end. You can see here scales will be attached to the skin, and here it is mobile. It's like this area is completely mobile and this area is completely attached. If we are stretching the skin in the long axis, we can see the scales opening like a curtain. So let's see where we can find this condition. So this is seen in pityriasis rosea. Once you see the herald patch, even you can directly go with the diagnosis of pityriasis rosea. But on examination, if we are getting this sign, then it is a confirmatory one. It is also called as hanging curtain sign because the scales will be looking like a curtain. Here in the knuckles of dominant hand, you can see the crusted callosities, and it is because of the repeated self-induced vomiting. I think you can easily guess the condition where people undergo self-induced vomiting in the fear of becoming obese. It is one of the psychiatric condition, that is none other than bulimia nervosa. The people will be eating food, and after that, because of the fear of becoming obese, they used to undergo vomiting, self-induced vomiting, and this sign is also called as Russell's sign. Here you can see the exfoliation like papillosquamous scales like lesion all over the face, but in case of nose, there is no such exfoliation. So let's see where we can find this condition exactly and what the sign it could be. So it is also called as rose sign or Pavitran's nose sign. This we can see in exfoliative dermatitis. In case of exfoliative dermatitis, we can see exfoliation all over the face except the nose. Okay, so that is very specific for the diagnosis. So this condition, seborrheic keratosis, we can see in lot of older age group patients whenever we are going out, or if a patient is coming to our OPD, we can see this type of lesion. So if a patient is having large number of seborrheic keratosis, what it is indicating? So it is indicating the sign of internal malignancy. We have to suspect for some internal malignancy, and this sign is also called as lesser Trellet sign. So we always come across an wonderful quote that what our mind knows, the eye sees. So same thing, if we are finding these type of difference in signs or symptoms in our OPD, then that will lead easily to the diagnosis of the condition, and this will help us in the MCQ point of view also. So thank you so much and happy learning with us.